to Soul Sessions, the show where we push to thrive in all aspects of wellness. Today, we're talking about our teeth. Now, my guest is a dental professional who helps people fix their smiles and, of course, helps them be confident from within. So whether you're scared to go to the dentist store or you're very happy with your shiny 32, today's talk is more than just brushing and flossing. So sit back and anticipate. My name is Osarennoma Saba. Most people know me as TheEdoQueen. Welcome to Soul Sessions. Right, we're still here on Soul Sessions here on Dominion Television, and like I said, today we're talking about our teeth, and my guest, like I said, is a dental professional. All right, so with me in the studio is Dr. Fikemi Lawal, also known as Dr. Fix, to talk to us about horror. Hey, I say horror, you see. One of the problems. Let's talk about oral hygiene. So welcome, Dr. Fix. How are you doing today?
I'm doing well. Thank you so much.
See your own shiny 32.
Let me feel too shy. I'm fine. Thank you so much.
All right. So, I mean, straight into it. Like I said, we're talking about oral hygiene, today. And it feels like there's some form of lack of awareness about the importance of oral hygiene. So what would you say, from your experience, what would you say is the importance of oral hygiene, and how does it also play a major role in our overall wellness?
Okay, like you said, which is very correct, not just people's assumptions, but it has been seen by research that the awareness of oral hygiene, especially in Nigeria, is quite inadequate or really deficient. And from my interaction with patients, you just ask them some questions or say certain things to them, and they are not aware of it at all. They don't even know what is going on in their mouth or what is wrong, or what is wrong about their technique in oral hygiene and all of that. And it's funny because many people are very concerned about aesthetics, and the teeth are when you see someone, you first of all are attracted to their smile, or that's the first thing that gets to you. And so if that's the first point of call, like in aesthetics, why are you not giving that much attention to it? So with physical aesthetics, how people look, it contributes to it. Also, when it comes to like mouth odor and everything, if the hygiene is poor, you can't hide it. You can't hide it. It's not just even about the hygiene. There are also other things, other say oral diseases and issues that could come up that people are not certain that is the cause of the mouth odor. They might think they are not doing well with hygiene and they put in a lot of effort. Meanwhile, something else is going on in their bodies
that is causing
that. So that's just an example. The teeth is in the mouth. The teeth are in the mouth. The mouth is part of the body. What affects the body affects the mouth. What affects the mouth affects the body. So it's an all-encompassing thing, and it's not just supposed to be treated on its own, but holistically, as one that if one is concerned about their health.
You mentioned mouth odor, right? One major thing people always talk about is body odor, but there's also the mouth odor. And to be very honest, sometimes people, we have people that wash their mouth like they're washing jeans. Still upon still, even though they're their mouth will still, not smell nice, right? So what really causes, mouth odor? Is brushing not enough, to be honest? Just so I can talk freely and people will not be holding their nose behind my back.
Yes, I love that question because everyone is a victim at some point in time. In the sense that if you've had a long day, say from morning that you've brushed your mouth, you've done a lot of things during the day, and it's evening, it's natural to have for the odor not to be as perfect as in the morning when you brushed. If you sleep, by the time you wake up, it's not exactly optimal.
Yes.
If you are fasting, for example, too, it tends to arise. So there are, and this is why I encourage people to visit the dentist, because in terms of mouth odor, which we call halitosis, there are two types. It's categorized in two types. There's physiological and there's pathological. Physiological is, I mean, things, morning breath, which is natural. Well, can be, maybe later on I'll talk about that one. Morning breath, say after a long day, fasting, and all of those things. Those are natural. But pathological, there could be something going on in the body that is causing that mouth odor. So like I was saying, one would think that, oh, they have to buy mouthwashes, brush and brush and brush and brush, which will be damaging their teeth, brushing too much.
That one, no hell.
And doing a lot of things. But if they presented to the dentist would examine all other areas and point to what exactly, if it is something physiological and you can, I mean, do other things, measures to just help with it, or is pathological that can be treated. So those are the causes. I'll just say that if for things like that is a dentist or a dental professional that will be able to tell you what exactly is causing your own category of mouth odor. But how often should we visit the dentist? Because even, in fact, earlier today I was speaking to someone and she was just saying, oh, her tooth is hurting her and it's been for a number of years. And I'm like, okay, have you been to the dentist? She's like, oh, she's removed one. It's like, it's just been moving, right? She has removed one already. She has a hole in another one and another one. And, you know, I just saw her taking medication. So I'm like, sometimes when people experience this, they probably just go to the doctor and probably just seek pain relievers, and maybe they just move on and either bear the pain. But to be honest, toothache is no small joke, right? So how often should we visit, you know, the dentist? Should it be like a weekly, monthly schedule thing? Because we see abroad people, you know, you see them saying, oh, I have a dentist appointment. Nothing to them, they just have a dentist appointment. So should we maybe bring that same culture here? Yes, that's actually what we are trying to, dental professionals are trying to pass on to people so that we can imbibe that culture. At least twice a year. It's even recommended generally in health that you go for a body checkup at least twice a year. So it's the same for the mouth. And that's because majority of toothbrushing does a lot. Toothbrushing, in fact, if a person doesn't brush or brush well adequately, that's not good at all. Toothbrushing does a lot. Flossing helps even more. But there are certain things that cannot be, you cannot clean your mouth adequately. How do I put this now? Okay, so let me illustrate it this way. Your teeth are doing a lot of work all day. So many things are going on in your mouth, even when you don't know, when you're asleep, and a lot of things are happening. Now you brush, say most people brush once, which is not good. You brush twice, yes, it's not good. Even when we brush twice, there are a lot of spaces in the mouth where this debris can accumulate in and stay. And the toothbrush might not be sufficient to take everything out. So in those hidden places, they accumulate and they build up, they harden, and they harden into something what we call calculus, in the sense that that cannot be removed by a toothbrush. So what we do in routine checkup is we assess the mouth. What is going on with this mouth? Is there anything that has to be treated? Is there anything that we can pinpoint early and avoid from escalating into a worse condition? And then then a procedure is done which we call scaling and polishing. That should be done twice a year, which removes those hard build-ups that the toothbrush cannot take anymore. The person that you mentioned about, you know, is one of the things that pains me a lot when I see issues that could have been salvaged from the beginning. And it gets to a point where we have no option but to remove the teeth. And one of the misconceptions that people have about dentists is that they just want to remove my teeth.
Yes, now.
And that, in fact, that is the last resort.
Extraction
no,
of filling.
We don't. I'm I'm telling you, that's actually the last resort, or if there are financial constraints of the patient. We actually want to save the teeth, but if you bring it at the point where it cannot be saved anymore, there's nothing we can do. So routine appointments help to check things that can be, gotten early and treated or prevented from escalating into worse conditions.
Because to be honest, to any small thing, all the times, my visit to the dentist, my first visit to the dentist was because I had a hole in my tooth. And I was much younger. I really didn't even know. I was always shouting, oh, I can't wait to show my 32. I can't wait to show my 32 until, I went to the dentist and then, I had a hole in my tooth and then they said, oh, the hole is too deep. It cannot be filled. It's affecting the pulp cavity. Either you fill or remove. I said, oh, Jesus, to remove. Right, I eventually removed it. But, in that case, what, caused mine was leaking a lot of sweets. I will not just lick it, but also break it. All right, and I will chew the chewing gum. Right. So, what lifestyle, habits do we see, people do that unknown to them is actually affecting, their dental health? Because for me now, I was just a young, beautiful child licking sweets. It's my classmates, Chamaka, that used to supply sweets to us. Right. So, what other lifestyle, habits do people engage in that they might not know is actually causing, issues to their dental health?
Okay, so starting from what you first mentioned is a lot of sugary diets. And well, but I would like to say that it's not just sugary diets that causes cavities. Okay. People think that, oh, it's just sugar, things that we know as sweets. Our regular foods that are carbohydrates also can. And this is the way cavities are caused. Basically, when food stays in the mouth without it being cleaned appropriately, acidic content are released basically, and they affect the tooth. Progressively, it worsens when the hygiene measure has not yet been put in place that will take years. And so that's how the cavity just slowly starts to form and all, and then it builds and it progresses and all of that. So one thing is sugary diets, but not just sugary diets. When one doesn't take the proper hygiene measure, even with regular eating.
Which is, you've mentioned like brushing twice.
Yes, brushing twice, and
that's morning and night.
Yes, morning and night. Because the food that you've had in your mouth stays over the night. It gives the bacteria a lot of time to act on it. And you now get up early in the morning, oh, you're rushing to work, you just use 1 minute, 30 seconds, and you actually don't take things out. So that's another thing that can cause, that's another habit. I mentioned sugary diet or improper hygiene measure. Improper hygiene measure. Also, not knowing, there are certain things one can do that can just help generally their hygiene. For example, if one takes a lot of tea, coffee, in our setting we have foods that have garlic, turmeric, all of those things. But there's one thing one can also do is that when you take these things, immediately rinse your mouth. Immediately rinse your mouth. It reduces the activity of the acid on the teeth.
You wash away the sweetness.
But you have already taken it. You I don't think so. I think another thing one can do though for drinks and is to use straw. If you use straw, it has it doesn't really contact the teeth surfaces. It just goes straight into. So we have sugary diet, improper hygiene measures, and like I've mentioned, not visiting the dentist. Also, certain things like how you eat. I think I've talked about one time about breaking bones. People like breaking bones a lot. I don't know what's the injury, but I'm not even talking about those soft bones like biscuit bones. Those hard. I met a patient one day, and I could see a lot of fractured teeth. Wow. So many teeth that we could only extract. But he said, I can't stop breaking bone. I can't stop. Like he said, no, they can extract it, but that bone, I can't.
There's a particular juice that's inside, bone marrow of the chicken.
For what? Anyway, that's just so. I think those are the ones that come top of my mind that I've seen commonly in people. If there are other habits that, there are other habits that some people have that they don't know about. Some people grind their teeth when they are sleeping, and all those things can be, of course, if they visit their dentist, one will see that and it can be attended to appropriately.
I mean, even just to add, I think probably like using your teeth to like you know, people do this to open
bottle covers. Yes.
I'm like, it even looks dangerous, to be honest. It really just looks dangerous. I've always been like, if you just try and your teeth come out with it. So I think that's also very that's like one major thing that I feel will probably, you know, affect, you know, our teeth. But essentially, just wrapping up, I think a lot of people have the notion that dental hygiene, dental care is expensive, right? Because like I said, in their blood, they say, I'm having an appointment with the dentist, right? If you want to do it here, it's not like it's free. You probably would have to pay for consultation. By the time they say, okay, you have to do this one. And you know how they always say you cannot go and see a doctor and they will not tell you something you need to do. You go and see them and you will not recommend scaling and polishing. You recommend teeth whitening. You recommend one thing, right? And, you know, people ordinarily, I think the typical Nigerian probably just think of an additional bill. So, I mean, economically, right, how can we, with the little we have, still, at some point, still maintain, you know, proper dental hygiene, even if we might not be able to do, you said 2 times in a year? If we're not able to do those visits, you know, to the dentist, what else can we do just on our own to just day?
Okay. All right. So, to answer that, I would tell a small story.
Yes.
I met a patient one day. It was in an oral surgery clinic, and this patient had an infection of the jaw.
Right.
It had already affected the face, and you know there was already like pus even coming out of the face, which was foul smelling, of course. And from the history, it dated back to 15 years prior to that time. He had a hole in his tooth, and you can as well guess, what did he do? He went to buy touch and go powder, used antibiotics, did so many things without doing the main thing he was supposed to do by actually coming to a dentist. Now, what struck me about, there was also another patient I met, really an old, it's something-year-old man. He was like, he has been doing everything to save a particular tooth because he did not want it to be extracted. And as at the time he presented, of course, it couldn't be saved anymore. We had to extract it. And, you know, he was saying that all the money that he spent on the other things he did were even more than the extraction.
Wow.
That
so it looks like it's not really expensive.
I'll get. So what I'm trying to pass across is, as Nigerians, major Nigerians, we like to take measures by ourselves, which sometimes can help if it's something you've gotten from a professional.
Okay.
But when you're doing the things, so many things that will eventually become expensive more than the actual thing you're supposed to do, who loses? Now, that person I first of all mentioned, if he had come when the hole was just incipient, just little, a 5,000 naira in UCH or 6,000 naira filling would have done it. And now it had escalated to an infection where it was going to millions, because it would have to do a surgery. They would have to remove the jaw, remove that aspect. Let me not go so that it does not seem gory to you. But in the end, his face wasn't even going to look good anymore because he waited for 15 years. And people just think it's teeth, nothing can happen. It's just teeth, nothing serious can happen. But even if we think it's not, the brushing twice daily, flossing, and I don't think visiting a dentist twice a year is that expensive, because especially if it's just for consultation and then scaling and polishing. When you visit a dentist, it's now people that are just after profit that will tell you certain things that you don't need. I mean, they'll just be recommending many things that are not necessary for you. But those 2 things, when they are done, I think they help in long term, and it's something that you can It's something that might not be so expensive if you plan towards it, of course. If you plan towards it. And prevention is cheaper and better than cure. When you go to a dentist, they will see other things that you don't know or you've not seen. And they will recommend what you can even do by yourself that would help you. Because not everybody's teeth are the same. So mine might just be, oh, just continue brushing. It might be that, oh, you have to do this other thing to make sure that this your hygiene is optimal and all of that too.
Well, I mean, so many new things we're learning on here on Soul Sessions. Thank you so much, Dr. Fix. But I mean, we still have Dr. Fix in the studio, and of course, we have a brief activity where we get to see and learn a bit more about the teeth. So don't go anywhere. We'll be right back in a bit. We're still here on Soul Sessions. Dr. Fix is in the studio still. We're talking about our teeth, oral hygiene, dental care, everything. But above all, she has said it is very important to visit your dentist at least twice in a year for consultation, checkup, scaling and polishing, and the works. And your 32 just will be shining every day, every time. All right, so we have this brief activity where, you know, I'm just going to hand over to her. So she tells us a bit about what we need to know, especially when dealing with our teeth. So, Dr. Fix, what do you have for us?
Okay, thank you so much. So, I have a dental model here that just, I mean, shows the teeth. Okay. Upper teeth.
Yes, you can just show. Okay. Yes.
So, then I have a toothbrush. So, first of all, from the kind of toothbrush you're supposed to use, do not use a hard textured toothbrush.
That's it.
I don't even know why they are still selling it. Anyway, do not use a hard textured toothbrush. There is the misconception that the harder you brush, the more you can get the dirt out, but it's actually doing worse on your teeth because it's eroding what we call the enamel. That's the protective outermost layer of your teeth. So when you brush with a hard textured toothbrush or you brush very hard, it's going to do a lot of damage to your teeth over time. So I'll just illustrate, because brushing is a major part of hygiene and it will do a lot. It will do a lot. In fact, even when you go to the dentist the other 2 times, there might not be a lot of debris they want to pick out because you're doing very well with your hygiene. So your brush, medium textured or soft textured, and then your paste, which should contain fluoride, by the way. There are many toothpastes that do not have fluoride. They just have minty things like that. Fluoride is important to keep your teeth strong. Your teeth are going to be in your mouth for the rest of your life.
Yes.
And so you need fluoride to keep it strong. So take your brush. Many of us like to, plaster throughout. It's not necessary. You're just wasting paste. And so you just need a pea size, actually, like a pea size of paste and you want to brush.
That's all?
Yes.
Okay.
Is enough.
Wow. Okay.
And so now say you're in front, you should brush with a mirror, but if you don't have one in your bathroom, there's no problem. Something that you can still. So you take, a number of us brush like this, just back and forth, back and forth, back and forth, back and forth. However, the truth is that the build-up of food debris, which we call plaque, the build-up usually occur along the gum line. That's where it stores most of the time. That's where it hardens and all of that along the gum line. So what you do is that you put your brush like at a 45-degree, and there's no need for a lot of mathematics. Just angulate it towards your gum.
Okay.
It's going to mess up this. Anyway, angulate it towards your gum, and then a circular motion. Okay. Circular motion along the gum, and then flick down. Sorry, this is getting all messed up already. circular motion along the gum and then down. So down strokes on the upper teeth, down strokes on the upper teeth, circular along the gum and then down strokes. Repeats along every, and very importantly, please don't miss your back teeth. It has been seen that the teeth that are usually disposed to cavities, yes, are the posterior teeth. So make sure that your toothbrush gets to the back, to the last teeth, and then you brush down from the gum
from
down
top to bottom.
from the, yes, from top to bottom. And same for the lower teeth too, from down up, down up, down up, down up, down up. Now please do not miss the inner part of your teeth. Many people do not pay attention to it because it doesn't show, but the plaque can also accumulate there, and so you do the same thing on the innermost part of the teeth, and then down, up, down, up, down, up, down, up, down. Then on the surfaces where you chew, you can brush this way. You can brush this way. From inside, so you can do this way, you can do this way, you can do this way. And then your tongue, please do not miss out your tongue. And you should brush for at least 2 to 3 minutes.
2 to 3 minutes, not 30 seconds.
Not 30 seconds.
No rub and shine.
Then very importantly, like I said, there are a lot of spaces in the mouth that food can hide, certain things. Now these teeth are fused together, so I might not be able to illustrate it very well, but this is what we call a dental floss. You're supposed to use it after you eat every time, but you can still use it like once a day, say before you brush or after you brush. You're supposed to take it in between your teeth. Sorry, this is fused. Our teeth are not usually fused like this, so there's like gap in between. So you put this inside, and then you take out the debris that are locked up in between the teeth. Don't use toothpick. I'm waiting for the time I'll go to an O&B and it's floss they will give us, not toothpick. But I know it can be like said, it's expensive, it's fine. But in your houses, please use dental floss and not toothpick. Thank you.
Amazing. Thank you so much. Very informative, very practical. I think what was interesting to see that you know, you don't just brush this way. You have to actually target where all the debris are. Lovely. I mean, it's been such a very interesting one. Thank you so much for coming through. But just before we go, real quick, what is one wellness advice you'd give to every single person that is watching? Okay. Pay attention to your body. If your body is telling you something, you can just feel that there's something up. Don't discard it. I'm not saying you should be paranoid about certain things, but make sure you do as is recommended. Now, I know there are a lot of advice and tips here and there, like how many things are we even going to do? But you know, the basics and the fundamentals to keep your body well and all of that, please do pay attention to it. Lovely. Wise words from Dr. Fix. Thank you so much for coming through. Thank you so much for educating us. It's been a lovely one. And of course, till our next episode on Soul Sessions, we would have another guest and of course another opportunity to learn. But before that, remember to pay your dentist a visit and check your 32, 31, 30. If it's not complete, check it, and just remember to remain healthy and well. Thank you so much for listening and watching today. I am Osarennoma Saba. Stay healthy.